This is going to be a video on joint play in the elbow. The elbow consists of three different joints: the ulnar-humeral joint, the radial-humeral joint, and the radial-ulnar joint. Let's look at the different movements that are possible in these three joints. For radial and ulnar deviation of the radius and the ulna on the humerus, have your patient in standing position with the elbow supinated and completely extended. Then fixate the humerus from the inside and grab onto the forearm proximal to the wrist and apply a varus or adduction force. For ulnar deviation of the radius and the ulna on the humerus, have your patient in standing position with the elbow supinated and completely extended. Grab onto the humerus from the outside and onto the forearm proximal to the wrist from the inside, and then apply a valgus or abduction force. Distraction of the olecranon from the humerus. Have your patient in supine-lying position with the ulnar-humeral joint in its MLPP, which is 70 degrees of flexion and 10% of supination. Then fixate the humerus with one hand while you palpate the joint line laterally with your thumb. With your other hand, grab on to the ulna and pull dorsally and distally. For distraction of the radius on the humerus, bring your patient's radial-humeral joint in its MLPP, which is full extension and 5 degrees of supination. Then fixate the humerus with one hand while you palpate the joint line with your index finger. Grab on to the radius proximal to the wrist with the other hand and then perform distal traction. You should feel the joint play in the joint line. For the PA and AP glide of the radius and the humerus, have your patient in sitting position with the arm to be tested on the treatment table. Then bring the radial-humeral joint in its MLPP and fixate the humerus with one hand while you palpate for the joint line with your thumb. Then try to find the radius with your other hand. For the PA glide, give pressure into the direction of your patient's chest. For the AP glide, you have the same fixation while you palpate the joint line. Then you have to remove all the extensors of the forearm and dig deep until you feel a dip. You have to be careful because this can be really sensitive for your patient. As soon as you find the dip, there you can feel the head of the radius. Now your movement goes into a distal and a bit caudal direction. Alright guys, this was our joint play video for the elbow. If you want to learn more about joint play, check out our video on joint play in the shoulder right here, or for joint play in the wrist right here. As always, if this video was helpful to you, hit the like button and subscribe to our channel if you haven't, and check out our webpage at PhysioTutors.com. This was Kai for PhysioTutors. I'll catch you next time. Bye.